Time, and I call the member for Kooyong.
Thank you, Mr Deputy Speaker. And I rise also to speak in support of this National Health Amendment General Co-Payment Bill 2022. And firstly, may I just note how nice it is to speak on a bill in such a bipartisan way, and how pleasant, thank you, how pleasant it has been over the last couple of days to hear from so many people with a medical professional background, the member from Dabell, for Robertson, Cooper and McKellar, pharmacists, nurses, doctors, about how strongly we feel about our PBS and its value in this country. But I have to say, Mr Deputy Speaker, that medicine affordability matters to all Australians, not just to those of us who have been involved in the healthcare sector. In 2020 to 2021, almost 2/3 of us needed at least one PBS medication. In total, 314 million prescriptions were dispensed under the PBS or the RPPS. This bill will reduce the Pharmaceutical Benefits Scheme general patient charge from $42.50 to $30 indexed annually. 3.6 million Australians with current scripts costing more than $30 will immediately save money as a result of this bill. The PBS is a vital part of our medical system. It ensures that Australians have timely, reliable and affordable access to safe medicines. It keeps otherwise overly expensive medications affordable. This move to decrease the co-payment for medication is a significant one. It is the first time in the 75-year history of the PBS that co-payment has been cut. It's worth remembering, though, that this bill only applies to the more expensive medications and for a subgroup of Australians. It will primarily benefit people who do not purchase a substantial amount of PBS medications each year and so do not hit the safety net threshold, and those who do not qualify for concession cards. The bill does not affect the safety net threshold or the concessional co-payment amount. According to the Australian Bureau of Statistics, in 2019 to 2020, nearly 900,000 Australians delayed having prescriptions filled or didn't have them filled at all due to the cost of those medications. People who need to choose and pick and choose which script they'll fill and which one they'll defer are potentially risking their health. They're also potentially having to put up with loss of function and with pain. Parents shouldn't have to choose between getting the medication that they need and putting food on the table for their families. I also note that we know that many PBS medications costing less than $30 per script will increase in cost after the 1st of October. This results from agreements made by the previous government with manufacturers to increase the cost of almost 1,000 medications. This happened during the COVID pandemic in mid-2021 as a result of the minimum stockholding requirements strategic agreement. But the fact remains that a $20 or $25 script is not a minor consideration for many Australian families. We need our government to advocate effectively on our behalf to secure medications as inexpensively as possible for this hugely important scheme. Finally, Mr Deputy Speaker, I would like to note that we need our government to promote best practice prescribing. In March 2022, the Morrison government defunded the NPS Medicine Wise scheme. NPS Medicine Wise is a 24-year-old scheme providing national leadership, education and resources on the best practice use of medications and medication safety in Australia. Its programs and resources reach all GPs. They reach 1/3 of residential aged care facilities across Australia. The program has made significant improvements to the health of Australians by reducing medication errors and decreasing overprescription. Its importance has been highlighted in the reports from Aged Care Commission on the safety of medications and the frequency of medication errors in aged care facilities. With the Albanese government, Minister Butler had the chance to reverse the decision to cancel the NPS Medicine Wise scheme, but chose not to do so. I believe that the Albanese government has erred in not reversing the decision to cancel the NPS Medicine Wise program. Proposals to transfer its activities to the Australian Commission on Safety and Quality in Healthcare or to competitive grant processes are undeveloped and relatively underfunded. Given that the government spends $14 billion a year on the PBS, the $24 million a year spent on the NPS is a pittance, especially given that this program has delivered a net return on investment of more than 2 to 1 to the federal government by delivering more than $1.1 billion in direct savings for the PBS and MBS. Improvements like a 25% decrease in the prescription or overprescription of some antibiotics, prevention of 50,000 unnecessary scans for low back pain, and 500,000, that's 500,000 fewer scripts for opioids, saving us more than $9 billion. The health of the Australian people and our budget bottom line will only be improved by ongoing support from our government for consumer education programs which improve health literacy. This bill provides the targeted healthcare intervention that we need to help those most in need of assistance with cost of living pressures. To further improve our health system, we need to optimise our use of prescription medications and to improve our healthcare outcomes. I call on the Albanese government to reverse its decision to withdraw support for the NPS Medicine Wise program.